Hey everyone, welcome back for another day with me, Ivana, and today I've got a really special guest. This is Sue Feldman, and she is one of the leaders of the team who developed the UAB Symptom Tracker. Now, if you haven't seen this, it is a very, very cool and very way above my head to even explain, but a very advanced piece of technology that's on the website, helpbeatcovid19.org. And this is a symptom tracker that comes in the form of a survey, and the team is encouraging people to take it every day, no matter whether you have symptoms or not. The word symptom tracker could be a little bit confusing to you, but even if you feel healthy, the team there is encouraging people to take this survey every day and share their symptoms. And what this does is creates a map where researchers can see if there are emerging hotspots across the state, or where a lot of areas, especially rural areas that don't have the access to healthcare or to testing like some of the metropolitan areas do, how these cases of COVID-19 are coming along and how people are feeling in those communities. So like I said, I have Sue here. She is a leader of that team, and this piece of technology is incredible, Sue, and it is really interesting how it was developed and how quickly it was developed. So before we jump into how it works, why don't you tell us a little bit about how this came to be?
Sure, and thanks for having me here today. So the leaders of the team are, of course, myself and Dr. Sarah Parkak out of the School of Arts and Science, the College of Arts and Sciences, also at UAB. She's an anthropologist. And then Dr. Mohan Thirummalai, I always mispronounce his name, and he is an assistant professor with me in the School of Health Professions. And Sarah has a very interesting story about how this got started. So I'm going to try and tell her story. She was out of the country, coming home to this firestorm, which we now know as COVID-19. And she was on the phone with some of her research friends and said, we have to do something about this. And her notion of do something about this came from losing her great-grandparents in the Spanish flu of 1819, Spanish flu, whenever that was. And so she just felt like something has to be done. And so that was on March 14th. And about 8 days later, we had Help Beat COVID-19 developed. So this is a process that typically takes 6 to 8 to 10 months. Thanks to Mohan and his team of programmers, we were able to get this done in about 6 days. And then we put it through testing. It took about 6 days to get it developed, a couple of days to get it tested, and then we got it out there. It went officially live on last Thursday, so not quite a week, and we have over 15,000 people have contributed their symptoms. And so in addition to our team, there's a whole host of people at UAB that have been incredibly supportive to our efforts. They have given us advice on what things need to be included, what things don't need to be included. They've given us user experience advice, and everybody has been very willing to share their thoughts and expertise with us across the UAB campus. And in a time like this, while that's nice, those are the same people who are on the front lines, super, super busy. And so you see somebody like Dr. Jeannie Marazzo, who's constantly on CNN. She gives of her time freely to help us with infectious disease symptoms that we should be thinking about and the way to word things and things like that. So we're very thankful for the team that has come together to put this together in a very short amount of time.
I mean, the fact that, like you said, this was done in about a week is wild to me, because it is so, the technology behind it, like I said before, is just amazing. And those things, like you said, typically take longer than a week or several days. So while we cannot, show you this in real time live, I do have some screenshots from the website that we're going to put up now. So this is what the website looks like when you first go visit helpbeatcovid19.org. There is this COVID-19 symptom tracker head. There is a spot to say, to get started, tell us how you feel. And you can click either I feel good, I feel sick. And this is the prompt to get you to take that survey, correct?
That's correct. And so we start the survey with just answering this simple question: how do you feel today? And then after you determine whether you feel well or sick, then you will be guided through a series of questions that are dependent upon how you answered that question.
I'm taking us to okay. Sorry to interrupt you, Sue. I'm going to just tell everybody, this is what, I took the survey this morning. I took these screenshots as I was doing it. And this is what, let's see if I can make this a little bigger. This is what the survey looks like when you first come on. It says, is this the first time you're taking this survey? Who are you completing the survey for? And this is just the first page before you get into the other questions.
Right. And so there's an important question there. Have you taken this survey before? The reason why we ask you that is because if you've taken the survey before, then we take you through a much more streamlined version of the survey. So the first time you go through, you're going to answer a variety of questions. You're going to answer questions around your symptoms. And it's a simple, just click on it, and then go to the next page. So it's very simple. You can do it on your cell phone. You can do it on the internet, on your computer, laptop, tablet, anything like that. And then at the very end, we're going to ask you for your phone number and your email address. And, it might be tempting to think, well, why do you need that information? That information is critical for a couple of reasons. First, we use that to identify you so that when you come back, you don't have to take the whole survey over again. So when you take it the second time or third time, it's a much more streamlined version. But that's the only way that we have to be able to match the responses to the person coming back.
Right.
The other thing that
I was just going to put up this symptom checker list that I saw when I was taking it. It's got a place to say, have you been experiencing any of the following symptoms within the last 7 days? And it's got between, let's say, about 16 different symptoms, and you can check as many apply to you. And that's just another way, like you said, to create that data. And then, like you said before, there is that spot at the very end where you click your email address and your phone number, and that's how they can match those symptoms with you.
That's right. And so some of the symptoms that you're looking at on the page right now might seem a little unusual. So there's 2 symptoms there. My food doesn't taste as good, and my food does not smell as good. And that's because loss of taste and loss of smell are 2 of the emerging symptoms that we are now finding pretty consistent with people who've been diagnosed with COVID-19. And so as that list increases, we will continue to put more symptoms on there. And on that same page, or maybe on the next page, I can't remember, there's a box that says, are you experiencing any symptoms that we have not asked you about? And the reason for that is to try and collect some of these emerging symptoms, because that is the only way that we can figure out what kinds of symptoms are people feeling and experiencing that we don't yet know about. That's part of the issue is that COVID-19 is so new and affecting people in different ways, and we want to try and collect as much information as we can.
It was this was the first time I did it, and the whole process took me 2 to 3 minutes. It didn't take long. But you said when you go back, I know since I took it today, I'm supposed to go back and do it tomorrow and every day. And so how long does it take after you do your initial survey when you come back for that second or third time?
So after you come back from taking it the first time, the subsequent survey will take about 10 seconds, as long as you're putting in the same phone number that you used last time. So you put in that phone number, we kind of behind the scenes, we match that phone number up to your answers from last time. And then depending on whether you said you feel sick or you feel well, we present you with certain questions, and then you're done. And that's what's nice about it, is that it has been highly optimized so that when you come back time after time after time, it's just very quick. And what we're hoping people do is work it into your daily routine. And some people are wondering, why if I don't feel anything, why do I need to keep coming back? And why do I need to keep putting in my symptoms if I don't feel anything? So I think it would be good for me to spend a couple of minutes talking about that. The reason why is because what COVID-19, Help Beat COVID-19 is doing is we are looking for emerging symptoms. So we are looking for where in the state of Alabama are symptoms starting to emerge. And this helps public health officials know about emerging symptoms without actually having to be in the communities. I mean, you all can imagine how busy they are now with testing centers and all the things that they're dealing with. I can't even imagine what they're dealing with. And so this is a way for them to be able to visualize on the map areas where there's emerging symptoms. The only way to figure out where symptoms are emerging is to know where there were no symptoms previously.
Right, and I'm putting up the map on the screen so people can see it. And in this map, you can see that there are different colors. So it's a map of the state, and then there are different counties and different areas are colored in different ways. And then there is a bar on the right that says you can switch the layer. So it can say 0 symptoms, 1 symptom, 2, 3, 4. And then there's also an interesting bar that says underlying health condition. So just as a disclaimer, I took these screenshots. This is not a live image. I took this at about 10:15, so about an hour ago. So if you go to this site right now and pull it up, those numbers might be a little bit different. So just putting that out there in case any of that has changed. But I've got it clicked on 2 symptoms. We see about 14,000 people reporting, and about 7,400 of those are reporting no symptoms.
Right. That's exactly right. And then what you can also do is if you're on your computer, it's much easier. You can go into certain counties. So you can click on the map itself, and you can look at your zip code. And the top right, it will show you what zip code, what city you're in, what zip code you're in. And so you can find your zip code, and you can see, how many people who have reported are reporting symptoms, how many symptoms they're reporting, how many in your zip code are reporting that they have underlying conditions and things like that.
It is. It's a fascinating look at how how people are reporting themselves. Again, this is something that is relying on self-reporting. This is not reliant on testing.
That's exactly right. And so that's an important point. And it's interesting that, so I'm a researcher, so I rely a lot on the literature. And I rely a lot on what other researchers have found out in same or similar conditions. And one thing that's very interesting about this time is that the literature suggests that when people can contribute their health symptoms and they can visualize something, that it will change behavior and it empowers them. And so what we're hoping is that that kind of a side benefit of this is that by people contributing their symptoms, they will then, just by being on the site, we have a lot of instructional information on the site that comes from CDC about hand washing and physical distancing and things like that, that people will take this seriously. And realize that they're contributing to the solution and not contributing to the pandemic. And that's a really important point for for us to realize as citizens of Alabama. I read a report out of the Kaiser Family Foundation yesterday that positions Alabama to be number one in the U.S. in deaths from COVID-19. And I think we as citizens of Alabama, I think we can change that a little bit. I hope we can change it a little bit. And I hope that Help Beat COVID-19 helps people become empowered by putting in their symptoms, tracking their symptoms, looking at the map, being engaged in it, and being engaged in the community while being physically distanced.
Right. And something you and I talked yesterday, because you were explaining this map a little bit to me before we decided to talk today. And something that you were explaining to me, because I was just honestly having a moment, and I was not getting it as much. I hadn't really looked through the site. And something that you said that really resonated with me was, there's a lot of people in some of these more rural areas, or these areas that are very far away from hospitals, or poorer communities that don't have the same access to doctors, to healthcare, or who don't receive regular, who don't get regular healthcare, who don't go to doctors regularly, and things like that. And this is a place for them to say, maybe I don't have a place to go get tested. Maybe I don't have a doctor to call to say I'm feeling like I could have COVID-19. Maybe you don't know you've been in contact with somebody, but this is a place you can go and you can look at your community and see what's happening in your community, and you can participate in that. And then with your daily participation, that can show how, I'm going to put this map back up again, that can show how these areas are getting more to a quote hotspot, or if things are going down in their area. So it's a little bit of a peace of mind, I think, for a lot of people who live in communities where they don't have the same access as places like Birmingham, Huntsville, Mobile, the bigger cities.
Yeah, you're absolutely right. And so one of the things that we're going to initiate next week, and it's all a work in progress. As we mentioned at the outset, this all happened very quickly, and so now we're going through and doing some refinements. And one of the refinements that we have scheduled for next week is to actually show the trend of symptoms. And so you can see, is the trend of symptoms in your area going up, or is the trend of symptoms in your area going down? And when I say your area, primarily your zip code or surrounding zip codes. And so that will be coming soon. By coming back to the site frequently, you get to see all the updates that we're doing. And the only way that that this can be helpful to public health officials is to have everyone do it. That's right. Really the only way. To have a few people do it, it just doesn't help. Something like this, you need everyone in the state contributing their symptoms.
This is exactly,
or lack of symptoms.
Right. And this is a very much a data collection tool. And something that I thought was really interesting that you also told me yesterday that I think bears repeating, and I got to read it because my brain space, my memory space is not real big right now. That this is, so a lot of people talk about the Alabama Department of Public Health map. We've seen that a lot. We have that on our site on AL.com, and we talk about that a lot. And this is very much a opposite look at that map. So that map from ADPH is showing the number of tested cases, the number of confirmed cases that they have the data on, that they have test results on. It's important to note that this map and this symptom tracker is based on self-reporting. So you and I and Sue and everybody in our neighborhoods and communities go in themselves, say what they're feeling. It doesn't have anything, doesn't really have anything to do with whether that person has been tested or has gotten a confirmed case.
That's right. That's exactly right. And we don't map confirmed cases or anything like that. What we are mapping is what's going on in your community that you're reporting. And so what this does is it helps us help you in your community. And without people going into helpbeatcovid19.org and taking the survey, we cannot help the communities. And that's really what we're trying to do, is get into the communities, help the communities without having to physically be in the communities. The ADPH map and the Johns Hopkins that many of you may have seen on the nightly news and things like that, those are reporting cases that have already been tested and tested positive, reporting deaths and things like that. We don't report any of that. We are looking from a completely different, albeit very important perspective. When you think of what's going on with COVID-19, you think that there's a continuum. There's a beginning and there's an end. And so while the end may not be so pleasant, that's what we hear about all the time, are the deaths. The end could also be the recoveries. We don't hear a whole lot about what's being done on the front end of that continuum. And that's what we are doing, is we're looking at the front end of that continuum. More specifically, we're looking at the front end of that continuum, trying to understand the nuances that are here in the South. We do have nuances here that are very specific to us, that do not exist anywhere else in the U.S. but in the southern U.S. And so there was a recent op-ed piece in the New York Times that called the American South the perfect storm. And so, when I think of the perfect storm, I think of weather, and I think of hurricanes and tornadoes. And if we know about hurricanes and tornadoes and we know they're coming, well, what do? Right? We prepare for them. And so I think of many reports like that. There have been several that have come out in the last 2 or 3 days. There was a big report last night on TV, on CNN, about COVID-19 in the American South. And I think if this is the perfect storm and we know it and we see it, Help Beat COVID-19 helps us get in front of it. And that's what we want to do, is get on the front end of that continuum.
Well, and this is a great way to do that. And again, this is something that y'all are encouraging Alabamians to take, whether you have symptoms or not, every day. Keep this map updated. Let's keep an eye on what's going on in our communities before those test results come in, if people get tested at all. So we appreciate it, Sue. Again, the URL for where you can see all of this information, we will put it in our comments, but if you're watching right now, it's right here at the bottom of the screen. It's helpbeatcovid19.org. You can see the map there. It is interactive. You can click on your area and click on the symptoms that you want to see, or click on the different filters that you want to see, and that will pop up for you. And you can see the numbers for the state as a whole there as well. So thank you so much, Sue, for everything, and for everything you're doing, and for explaining this technology to us, because I know a lot of people will be very interested to go visit the site and take the tracker.
You bet. And thanks for having me today on AL.com. Appreciate it. Appreciate you helping us get the word out.
Thank you, Sue, and thank all of you. And go take that symptom tracker and tell us how it worked for you. Tell us what your experience was. And for everybody else, we will see you tomorrow.